Hi, everyone. My name is Anjay Rastogi, and welcome to our December edition of the chat. And today we actually have a very special guest, Dr. Al Rashid, and she'll be going over oral medicine and oral health. And so before we get into the presentation, I want to give a brief introduction of Dr. Rashid. Dr. Rana Al Rashid was born and raised in Amman, Jordan. She graduated from the University of Jordan School of Dentistry in 1997. She joined the Advanced Clinical Training Program at UCLA School of Dentistry in 2008. Dr. Al Rashid distinguished herself for her clinical skills and artistic abilities. Since 2009, she has maintained a position as a continuing lecturer at the Department of Restorative Dentistry. She has enjoyed teaching students and residents at the Advanced Education in the General Dentistry program. She is currently a group practice leader in the Interdisciplinary Dentistry Department and sees her patients at the UCLA Faculty Practice Group. Dr. Al Rashid is passionate about wellness and health, and so are we at Core Kidney, and that's why we met. So it's a real pleasure to have her. And when I met Dr. Rashid, it looks like we connected, because she believes in overall wellness, holistic medicine, and taking care of every part, and especially the oral health that's often neglected, not just by patients, but also by providers. And this will be a very special topic today. She believes that oral health cannot be separated from overall health, which, like I said, I truly believe in. In February of this year, she finished her fellowship in integrative medicine at the prestigious Andrew Weil Center for Integrative Medicine, University of Arizona. So integrative care is something that we also focus on a fair bit. Having all these specialties collaborate together. She's trained in MBSR. You will need to let me know what MBSR is, as well as Transcendental Meditation, TM. She believes in a holistic approach to treating patients. She trained in acupuncture for sleep and orofacial pain at UCLA, as well as auricular acupuncture at the renowned HEMS Institute. She employs different evidence-based modalities and healing practices to help patients during their visit and beyond. Dr. Al Rashid is also an avid learner. She's always refining and elevating her knowledge by taking numerous courses that pertain to bringing optimal care for the patient as whole. She's a loving mother of 3 kids. She enjoys reading, yoga, travel, and spending time with family and friends. So I think, Dr. Al Rashid, you're made for the Core Kidney program. All that stuff you said is actually what we speak about. But I just want to, before I let you speak a few things, I just want to say, we spoke about that. I was actually in Amman, Jordan in 2018, and I just had a lovely, wonderful time. The people were wonderful, so much history. But the reason I went there was because the person who started the Brewing Beans Health Club, or undergraduate health club, Maha Kubain, was from Jordan. So she was the undergraduate at UCLA, and when she was in the Core Kidney program, she and I and a couple of other people spoke about the Brewing Beans. So there's a big connection between Jordan and UCLA and the Brewing Beans. So Dr. Rashid, welcome.
Thank you very much for having me. It is a pleasure for me to be there. I'm honored to be on the panel with everybody. And I'm, like you said, there was a connection. It was a random meeting, I have to say, and just how everything transpired. So thank you very much for inviting me.
Well, thank you. Thank you, Dr. Rashid. And I also want to mention, we also have a few other physicians, our members. We have Dr. Molly Sarkar, our transplant nephrologist. We have Dr. Shah, also our transplant nephrologist. We have Dr. Jim Cunningham, our psychologist, and we have a fair bit of our circle of core members over here as well. We have Louis, we have Nanette. Who else do we have? Those are probably the main ones. Brock is there, and we have our beans. So, Dr. Rashid, you can take it from over here.
Okay, excellent. Good afternoon, everybody. Thank you again for having me. As Dr. Rastogi said, I am a firm believer in the holistic approach to overall health. You cannot have a healthy body without having a healthy mouth. My objective today, these are the general objectives. So because of my training, I do believe that breathing will help start the relaxation response in patients. So we establish the pathway. The more the patients do the breathing exercise outside of the stressing event, the faster that the pathway is established and the body responds with relaxation and lesser anxiety. So this, and this works also for people who struggle to initiate sleep, or patients or general people who will wake up during the night and cannot go back to sleep. It is called the 4-7-8 breathing technique. There are multiple breathing techniques that are out there. This is my favorite. And another time we can talk about other relaxation techniques. The MBSR, it is mindfulness-based stress reduction technique, and it's a more involved training, but for me, simple, easy, and free. You do it if you like it, and if you do not, it doesn't work for you, no, like you don't have to do it again. So it's called 4-7-8 breathing technique. You inhale through your nose for 4 counts, and then you hold your breath for 7 counts, and then you exhale through your mouth for a count of 8. And then you start with an exhale. You take a deep breath through your nose for a count of 4. I will count, hold the breath for 7, and then exhale for 8. And then most of the patients feel immediate relaxation. And again, the more you do it, the faster you will feel the effect of it. So let's do it all together. If you feel comfortable, close your eyes. Start with an exhale, empty out your lung. Deep inhale through your nose. 2, 3, 4. Hold your breath. 2, 3, 4, 5, 6, 7. Exhale for a count of 8. 2, 3, 4, 5, 6, 7, 8. We'll do it 2 more times. Inhale through your nose. 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. And exhale. 2, 3, 4, 5, 6, 7, 8. Last time. Inhale. 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. And exhale. 2, 3, 4, 5, 6, 7, 8. So I do this with all patients before we start. And I tell them to try to do it during, if they feel anxious and they want to take a break. With that, we can start the presentation, please. So meticulous oral care and good diet will give you balanced microbiome and lower overall inflammation. I tell patients foods that are bad for your body are typically bad for your mouth, and foods that are bad for your mouth are also bad for your body. I tell patients try to not eat anything that comes out of a box, because chances are that will have more, build more plaque on the teeth and make oral care a bit more involved. Next, please. So the mouth is the mirror for health or disease. The mouth is part of the GI tract, and we just, when the patient opens their mouth, we don't only look at the teeth, we look at the tongue, we look at the gingiva, we look at all the oral mucosa. So if it's an early indicator of disease. Next. Okay, so steps for oral care. Many people might do all of these. You might end up doing all. If you add one more step to your oral health care, that it will, for me, I would feel very happy, because it will add so much benefit to your overall health. So there's a little bit of a controversy between dentists, floss or brush first. I believe in flossing first. So first you floss, then we use a water pick. For people who are unaware of water pick is, let me first say, I have no financial affiliation with any of the products or the companies that I'm going to mention. The reason I mention them is because I tried them personally and we recommend them for patients, me and many of my colleagues, and we believe that they work. So that's the only reason I am mentioning them. So you floss, water pick, and using a rubber tip, brush, using a tongue scraper, and then make sure to get your cleanings, dental cleanings every 3 months, 4 months, or 6 months, depending on your dentist's recommendation or hygienist's recommendation, and see your dentist for annual checkups. Thank you. Next, please. So when I was in dental school, I remember the periodontology class, they said, tell the patients floss the teeth you want to keep. But now you floss for overall health, because flossing is more than just the local inflammation. Flossing is to make sure that to lower overall body inflammation. The right technique to flossing is to take the thread down under the gingiva gently, hug the tooth, move the floss back and forth, wipe the floss and move to the next tooth. There are also floss picks. They're also okay to use. I prefer this one because you can get the C hugging up around the neck of the tooth and make sure to get all that thin biofilm off the surface of the tooth. Next. So this is a video. This is what a water pick looks like. There are different models. This is what I have at home because it is portable. It goes well on the in the bathroom. Doesn't take much space. There aren't hoses and it's not messy. So you can add some hydrogen peroxide, and not every day, maybe every other day, to the reservoir. It's in the back and you can charge it. You use it basically after flossing. Can you start the video, please? Thank you. So it is not instead of flossing, it's adding to flossing. If you feel that you cannot do both, just stick to the flossing. Perfect, thank you. Next. Okay, so brushing. So brush when you first wake up, because sometimes when we sleep, some patients sleep with their mouth open. There would be more plaque buildup. So brush and you feel fresh. If you want to brush after meals, make sure to brush 30 minutes after the meal, not immediately after eating, just to allow the teeth to remineralize. Sometimes if you're having something acidic, it might make the tooth structure a little weaker. So brushing you would be abrading the tooth surface. And in the evening, try to brush like 30 minutes after dinner. Brush, floss, do your oral hygiene after dinner, because if you end up delaying it to right before bed, chances are you're not going to be doing as meticulous doing it. And change the toothbrush or the brush head every 3 months. Next. If you're using a manual toothbrush, I personally recommend an electric toothbrush, but if you like using your manual toothbrush, always opt for a soft toothbrush. The right brushing technique that not many people are aware of is called bass brushing technique. And the way to do it is just like the illustration shows. So you tilt the brush at 45-degree angle towards the gingiva. You do small circular brushes, it's a small circular motion. And I always recommend for patients to use their non-dominant hand, because easy does it. You're removing a very thin oral biofilm. You're not scrubbing paint off your teeth. So do not brush, do not add to the force of the brushing, and always charge it too. Next. This is the rubber tip stimulator. I think not many people are familiar with it. I recommend using it after brushing, just in case something was left. You make sure, can we start the video? Thank you. So it's flexible. It's not going to poke you. It just gently goes under the gums to make sure that everything, all the biofilm has been removed. So typically your hygienist or dentist will recommend certain areas. In patients with kidney disease, I would recommend using it all around just because of the body's the way that fluoride works, the reason we believe in it, because it goes into the structure of the tooth, making it stronger and more resistant to decay. Next. Excuse me. Products we do not want in our toothpaste, especially for your patient population, is SLS. It's sodium lauryl sulfate. It is not toxic. It's not bad, but it does cause irritation in some patients. So switching from, if you are prone to getting a lot of ulceration, switching to SLS-free toothpaste is associated with lower incidence and duration of canker sores. These are a couple of toothpaste that are SLS-free. Please do not use charcoal toothpaste because it's very abrasive. Many people choose the charcoal because of the whitening effect. So don't use it, please. Next. So for mouthwash, I believe in the targeted use of mouthwash. We do not want to disrupt the microbiome too much. Some mouthwashes will have fluoride that we'll talk about later for the patient population in kidney disease. An example is ACT and Closis. For xerostomia is what we call dry tooth. It's the scientific term for dry mouth. TheraBreath, Biotin are two excellent brands. Always choose a fluoride without alcohol. Chlorhexidine is a medical grade mouthwash, and it's often used in periodontitis. It is not recommended to be used longer than 1 week in a month because it would disrupt the oral microbiome, and there have been some studies that it elevates blood pressure. And the mechanism of elevating the blood pressure, that because it's an antimicrobial mouthwash, it kills everything. So it kills the good bacteria, the bad bacteria, it kills candida, it kills everything. And on the tongue surface, there is a bacteria that will it will convert the next, please. Okay, so now we're gonna, should I stop here if anybody has questions, or shall I keep going, Dr. Rastogi?
I think there was one question, Dr. Rashid, is from Aaron. Are all these suggestions true for pediatric patients too, 10 years old?
Yeah. Yes, the same recommendations are for pediatric patients. Now, the fluoride content for pediatric patients, you have to make sure that you do not put more than a pea-size toothpaste for the pediatric, depending on the age, and make sure that they rinse very well and spit.
Great. Thank you so much.
Of course. Okay, so now we move on to talk about disease in the mouth. So we have, if we're meticulous in the oral hygiene, we do not get gingivitis or periodontitis. So that's why I went into detail for everybody to get, if we stick to that, no one will have gum disease. Now, in the kidney population, there is a more susceptibility for gingivitis and periodontitis, and we'll go a little bit in depth about that too. So gingivitis, there's inflammation in the gum because of the plaque biofilm that is stuck on the teeth. It causes bleeding on the gum tissue. If you look at the diagram, so healthy gum, you have the tooth, you have the gum and the bone underneath, everything is great. You have a little bit of plaque and then a little bit of inflammation in the top layer, the gingiva, and then you have some bleeding. So once we see bleeding, that's when we call it gingivitis, bleeding or other signs of inflammation, obviously. Now, if the plaque stays and it turns into, and more deposits are in it, it becomes calculus, and more calculus happens. When more calculus is deposited on the tooth, then you will have bone loss and collagen breaking of the collagen matrix. So you have plaque, you have tartar matrix causing inflammation. The inflammation releases toxins, and the toxins will cause bone loss, pocket formation, and then more bacteria, more toxins, more bone loss, and then you get mobility, and then teeth become loose, and you might lose the tooth. Next, please. So periodontal inflammation is a proven culprit in cardiovascular disease and in diabetes. And now they're talking about it being a culprit in Parkinson's, Alzheimer's, of course, chronic kidney disease. There are some reports about the effect that it has on pregnant women and abortion, early and miscarriage, not abortion, sorry, early miscarriage and erectile dysfunction. So in end-stage renal disease, there is a higher score of decayed, missing, and failed teeth. It's all the studies have shown that. So kidney patients are at higher risk. Next, please. In this diagram, you see how periodontitis has an effect on impaired renal function. So like we said before, that you have with periodontitis, there is higher oxidative stress, there is higher C-reactive protein, interleukin-6, all the toxins that are released, and that will directly affect the renal function. Scaling and root planing and getting, scaling, root planing, flossing, optimal oral hygiene. Just as periodontitis will raise the C-reactive protein, getting the scaling, flossing, the optimal oral hygiene will decrease the CRP, the C-reactive protein and inflammation. That's why the patient is in control. Next, please. Look at the numbers here. And it is a vicious cycle. So a 10% increase in gum inflammation will cause a 3% decrease in kidney function. And the 3% decrease in kidney function will cause a 2% higher chance, I wrote it somewhere, a higher percentage of kidney failure. So you get gum inflammation, decrease in kidney function. And then when there's a decrease in kidney function, then 10%, it's a 25% increase in gum inflammation. So at 10%, you got 3% decrease in kidney function. At 25%, imagine how much decrease in kidney function. That's why, again, the patient should be in control of. It's such an easy habit to have, and once it is mastered, it does help a lot. Next, please. From the capillaries around the teeth when you brush your teeth into the bloodstream. When someone is sick and they have periodontal disease, there is more load of pathogenic bacteria, and the body's response to the bacteria isn't great. So the body cannot handle the bacteremia. That's why you have adverse pregnancy outcomes. That's why we see deposits of some of periodontal, the bacteria that causes periodontitis. It's reported to be found in Alzheimer's patients' brains. it is also implicated in rheumatoid arthritis. So again, just one more slide to drive home the importance of oral health. Next, please. Okay, so now we're talking, any questions? Okay, so now we're going to talk about some manifestations of chronic kidney disease in the patient's mouth. So this is more specific to the patient population that we're talking about here. Because of the medications that some patients will have, the immunosuppressive medications, and the blood pressure medications that they have, we see that some patients will present with the red, white patches on the tongue and in the cheek mucosa, the oral mucosa. It's called hairy leukoplakia. It is drug related. Because of the high concentration of urea in the mouth, we have ammonia-like smell. Some patients will have nausea, they'll have metallic taste and uremic glossitis. The nausea will sometimes also cause some reflux with the patients, and we will see that on the surfaces of the teeth, which will cause more sensitivity. We also see enlarged asymptomatic salivary glands when we examine patients. Next. So xerostomia is the term we use for dry mouth. So if you look at the photo here, on the right side of the photo is a healthy tongue, and on the left side of the photo is a dry mouth tongue. And it happens because of the altered fluid balance that is the nature of this, of kidney disease, and because of many medications. It also is more pronounced with mouth breathing. Patients who breathe through their mouth, we see maybe not as much on the tongue, but we can see it on the anterior gingiva and on the, especially on the top teeth. There is lower salivary flow because of the fluid imbalance, and the saliva has higher viscosity and low buffering effect. So in a healthy patient, you will have, the saliva has a buffering effect. So someone eats something and then the saliva will help clean and keep the teeth moist so decay doesn't happen and the plaque doesn't build up. Now, interesting that patients, the kidney patients, because of the uremia, the pH is a bit on the higher side of the saliva. So we see not as much decay, but we see a lot of gum disease, periodontitis and gingivitis. Another symptom of xerostomia is burning sensation. Typically, when you have less saliva, in most patients, you will have more decay. And then again, more gum disease. If someone wears dentures, the lack of saliva will make the dentures not fit well, and more rubbing against the gingiva and more abrasion, so it's not comfortable for the patient. Next. Okay, so this is my armamentarium for helping patients with dry mouth. I'll go one by one. So the smell of lemon, even I tell the patient sometimes try to think about lemon, and immediately it helps some patients salivate more. We used to recommend sugar-free lemon drops. Now, with all the studies about the acidity and in the mouth and how it is a culprit of decay, I stopped recommending anything lemony in the mouth. But we do recommend xylitol lozenges. Xylomelts is a great product that will help coat the gum, the gingiva, and will also help some patients produce more saliva. Sugar-free mints are great. Pure it's aspartame-free. It is xylitol gum. that can help with maintaining cleanliness in the mouth and stick to the tissues and gives the patients one of the best sensations. MI paste helps with the remineralization of the dentition. Some patients that have very bad burning sensation will benefit from swishing with olive oil, and it's actually something that you can swallow. So I highly recommend that. There's another product that has aloe. Aloe vera is very healing to the mouth. So just make sure that it's not aloe vera juice, because that would contain sugar and that would be kind of counterproductive. So I found this product that does have aloe, and it's a mouthwash, so it's great to use. Swishing during the day a couple of times with ACT to mouthwash, it does have fluoride in it. So it would help people that are at high risk for decay. Again, your toothpaste, of course, for sure. Acupuncture, there's been a study done a while back that there are 2 points, L1, L2, Li2, that have helped patients with xerostomia after, I think, 3 sessions. Mouth taping, I'm not sure how many of you are aware. This is the latest thing in the wellness world. There has been many studies and many books written about it. For us in dentistry, if you're talking only about the oral cavity, mouth taping is, I tell patients, it is very cheap. You try it, you like it, you keep doing it. You don't like it, don't do it anymore. But for patients who tend to breathe through their mouth, sealing the mouth, and it's not complete sealing. If you see in the pictures, there are 2 kinds. The one that covers all the mouth, it does have some holes in between, so you can breathe. It's not like completely taping your mouth. And the other one, it's just approximation of the lips together to help you breathe through your nose. Nasal breathing is good for overall health. Again, we go back to the nitric oxide, which relaxes the body. Breathing in through your nose will change the ambient air to nitric oxide, which will lower blood pressure. You will get more restful sleep, and it will keep your oral cavity nice and moist, and with less chance for periodontal disease and less chance for decay. So I am a high supporter, a big supporter of mouth taping. For patients who have a lot of inflammation and they do not, like, they do everything and still there's a lot of bleeding, you can take some over-the-counter cortisone, just a tiny bit, apply twice a week, twice or 3 times a week after brushing, after all your oral regime has been done. Just apply it to the gums where you feel that the gums are still angry and inflamed, and it should help. Patients who have dry lips, lanolin cream, it's actually in the book. There is more calculus production, again, although we said there could be less decay in some patients. There is enamel hypoplasia that presents especially with children. In the x-rays, you will see loss of lamina dura and abnormal bone healing. Some patients will have more problems with TMJ, and that is something to follow up with the specialist. Next. Okay, so this is another vicious cycle slide where you see uremia that is common in chronic kidney patients and the drugs that the patients take. So there's oral ulceration, stomatitis, bad odor in the mouth, metallic taste. The patient doesn't feel great, so you have psychological problems. So all of that will give you poor oral hygiene. And poor oral hygiene will have more, the patient will have more periodontal problems, and more periodontal problems with the xerostomia and the renal osteodystrophy. you will have tooth loss. And once you have tooth loss, are you going to eat more or less? You're going to have dental prostheses that don't fit great, masticatory deficiency. You might have increased decay, of course, when all of that is happening. And then the patient doesn't eat as much. And then you have nutritional deficiency and protein wasting. So it's just a vicious cycle. So we have to try to break the cycle at one point to help the patient. Next. So that's where the patient-dentist partnership is. And doctor, I have to say physician. So we need to arrest progressive disease to lower inflammation, and we need to restore lost tooth structure to improve nutrition and the quality of life. Next. So gingival hyperplasia, we see that, of course, with patients who take cyclosporins after kidney transplant. In some patients, it will cause a plaque control problem. It will affect mastication, alter the tooth eruption, especially in younger patients. It will interfere with speech, aesthetic concerns for many, and in many cases, it will cause tooth mobility and tooth loss. Next. So the reason it happens, it is secondary to medication. So cyclosporin and nifedipine, we see it in 25 to 30% of adults and 70% of children. Of course, if the patient needs to talk to their doctor, to their nephrologist, but switching from cyclosporin to tacrolimus, there has been many reports of the hyperplasia spontaneously resolving within 6 to 12 months. In many cases, for aesthetics and for other reasons, surgical intervention is an option. This was done by UCLA's Dr. Camargo in the periodontology department, and you can see how the result is amazing. In many, sometimes, not in many, sometimes the hyperplasia will come back, but keeping good oral hygiene will help maintain the result. Next. So when a patient is taking cyclosporin, the patient is in an immunodepressed state. So you'll see opportunistic infections. We do a dental evaluation, complete dental evaluation prior to the renal transplant. We want to make sure that the fillings that are needed are done and all the extractions of unpredictable teeth is done before the renal transplant happens. We do not want any infection to happen after in a patient with an suppressed state, that is after the transplant happens, because we need to avoid all dental treatments 6 months not extraction, 6 months after the transplant. Antibiotic prophylaxis is a must. It's 1 hour before the appointment, same thing, 2 grams of amoxicillin or 500 milligrams of azithromycin. Next. Supplements that typically when I see patients, I recommend, because we want to increase the body's response to inflammation, always talk to your physician, please, before taking anything. B complex 50 micrograms has been shown to help. Vitamin D3, 1,000 milligrams. Calcium, 1,000 milligrams, and elderberry has excellent immunomodulating properties to help the body's response. Please try to eat more foods containing vitamin C, zinc, and magnesium. Of course, we have Shima here that she can add to that. But these foods containing those will help the body's response. Next. Okay, so at your dental appointment, again, we want to change the narrative. So we do not want your dental appointment to be a very, very stressful event. I do these with my patients, but not all dentists do that. So again, we are empowering you. We want you to do it. So at your dental appointment, before you go and when you're in the chair, do the breathing 4, 7, 8. It's again, inhale for 4, hold for 7, and you exhale for 8. There are many meditations apps that you can use or self-hypnosis apps. I tell the patients, go to your happy place. And in the pictures that I have included, these are my happy places. When I close my eyes, that's where I go, or I go to a beach somewhere. So going to the dentist can move from being a stressful appointment to just you being zen with yourself, with, wow, they do their thing. Take your favorite lip balm for your lips and do aromatherapy. Take aromatherapy. If you can take a little bit of aromatherapy, put it on a 2x2 from the dentist or on a tissue and just keep smelling it. Take your AirPods, listen to music, and good luck. Thank you. That's the end of my presentation.
Thank you so much, Dr. Al-Rashid. I think one more question came up about amlodipine. For gingival hyperplasia. I mean, I've known cases with nifedipine.
Yeah, no, amlodipine has not. It's not common with amlodipine.
So it might have been.
They would switch nifedipine to amlodipine.
Yeah. So Erin, I mean, I don't know but looks like when they stopped this case or medication, it went away. So, but this was amazing. I learned that I should be brushing with my other hand, not my dominant hand. I think that's something that I learned. Any questions or comments from the group? I mean, I think the reason why I really wanted you, Dr. Rashid, to come by, obviously you bring a lot more than just oral health, meditation and stuff, but it's something that we don't really pay attention to. We give antibiotics prophylactically. It is a procedure, but there is a connection between inflammation, the dental health, cardiovascular system, and the heart. So I think that's something that's very important, and also any condition with inflammation. So I think we have our resident psychologist, psychotherapist.
Hi, Dr. Rashid. It was a very informative lecture. I'm Jim Cunningham. I'm the psychotherapist.
But since you're on, any other advice for the holidays? We talked about, Dr. Rashid went over a lot of stuff with the meditation and your happy place and all that stuff, which is awesome.
Self-care. I mean, I think this kind of goes under the jurisdiction of self-care and and not just dental hygiene, but emotional well-being and exercise and vascularity and eating right and trying to stay away from stressful situations. It's pretty basic, but you got to practice it. I mean, it's easy to say, but it's hard to implement. So.
And I know you've been very busy. Dr. Rashid is trying to join back in. I think she got kicked out. And then, Shima, anything else from your perspective? Dr. Sarkar is here as well. Dr. Shah.
Hi, everyone.
Hi, Shima.
Hi, Dr. Cunningham. Like Dr. Cunningham said, exactly. It's just so hard sometimes to just say it because I feel like sometimes we keep saying it and we get all these questions, especially during the Thanksgiving time and then during the holiday. So what should I do? Because other people are eating like other kind of like food and then I have like my limitations. But I think at this time, like balancing everything and just like being mindful about what you're doing is the best way to do it. Because when you keep thinking about it, then you start stressing about it and it gets worse. But if you be more mindful about it and know like how to substitute one thing for another, that's the best way, because it's not the limitation. It's just like there's always a way. Like if somebody told you that you cannot have avocados, then you can just enjoy something else, right? So that's a big one during the especially holidays time.
Dr. Sarkar, you want to say something?
I would say, I have been given this role of talking about transplant most of the time. So in that context, I will tell you, this is a very, very important aspect before you go for that big surgery in your care. And you would be surprised how many times people's surgery get delayed just because the dental health is not up to speed. It's important for your anesthesiologist. It's important for your doctor. And, not just the kidney. Dental health is very important for your heart. Those infections travel to the heart very fast. And when you're a kidney patient, you're already a little bit immune compromised to begin with. There are going to be big medications coming in. There's going to be steroids that are going to impact your bones, and things can fall apart. So tiny, but absolutely very, very, very important to take care of these things.
Yeah, no, I think thanks for reinforcing the dental health, because we tend to overlook this, and you're absolutely right. Surgeries have been delayed, sometimes even canceled. I mean, they had to take out the entire set of teeth. I mean, when I was a fellow, I saw this patient that all the teeth were taken out. It was horrible.
And on that point too, if this is not possible because we are rushing into a transplant situation, sometimes things don't pan out. As alluded to in Dr. Rashid's presentation, you will then wait 6 months before your dental health could be addressed.
That's true. That's a very good.
So you have to be proactive and believe in prevention than intervention, right?
Yep. And going back to Shima's point, I think mindfulness is important, the balance, trading things off, taking your binders, right? I know you tell your patients all the time to take their binders, but I always say, if you're going to have a meal that's high in phosphorus, you're going to have a steak, once in a while, it's okay, enjoy life. But take your binders, take extra binders with that. So I think you're absolutely right. It's just balancing things, chewing your foods. And that once again comes back to your teeth, right? You chew your food, smaller portions, balance it out. So we're waiting for Dr. Rashid to join back in, but I don't know if she's able to. But anyways, I think we're all getting on top of the hour over here, or bottom, like they say. Any other comments? Dr. Shah, you're here too. You want to say a few things, or is he still here? Oh, there he is. Hi, Dr. Shah.
Hi, good evening, everybody. Good evening, Dr. Rastogi. I truly enjoyed the presentation. Really great information there. I learned a lot as well. And I will echo for kidney transplant patients, I'll echo what Dr. Sarkar already said. And it's a very important part of medical management, often, pushed aside to the back burner just because, it's a closed oral cavity. But couldn't emphasize more what Dr. Sarkar just said. And pre-transplant and post-transplant, dental hygiene, dental health becomes so much more important for the best outcomes for the patient and the kidney transplant.
Yep.
So and the other point, which Dr. Sarkar already probably said, is all kidney transplant patients are provided with a dental prophylaxis material and things to give to the dentist, recommendations from us to give to the dentist so that there's no delay.
And take your medications. That's the other thing that keep in mind.
Take your toothbrush too.
Take your toothbrush too. And dental floss.
Yes. And I think I would add, Christina, unfortunately, also has an internet issue, but she texted a very important point. Like in our bathroom, like our makeup and like other stations, we should focus on a dental hygiene station. I think that's very important.
Yes. So she's also having some people having. But anyways, I just want to thank everybody and all the good points that were brought up. I hope you have a wonderful holiday season. We'll have there she's back.
I think I'm back.
Yes.
I'm so sorry. It completely crashed.
No, there were some very nice comments made about your presentation, Dr. Rashid.
Thank
Dr. Shah spoke about this. I think Jim was
Yeah.
asking.
I have a quick question, and I don't know if this is tangential, but have you ever heard of, I think you mentioned it or alluded to it, oil pulling with like olive oil or sesame seed oil or coconut oil?
I think coconut oil is newer to the wellness world. Olive
Sesame
oil,
seed oil or whatever they talk about.
yes. Olive oil. I'm not a proponent of oil pulling. Just gargling with it and then swallowing it. If they want to try to oil pulling, it's not good. It doesn't have any harmful effect. But using it's very soothing, and it has anti-inflammatory effects on the body.
So, and I that's what my inclination was, that you could do it with water. It was just, it's the same kind of thing.
Yeah, it's just the hype, I think, that's going to go away.
Wishing gets rid of the plaque and the.
I tried it. There is nothing like the mechanical removal of the plaque. Nothing's gonna take away the plaque as the mechanical removal of the plaque. For anybody who wants to try, please go ahead. I tried, like the reason I talk about the products, because I don't recommend anything without trying it first. And I never say no to anything unless it's drugs without trying it first. The same so I did try the oil pulling. I bought a couple of years ago. I bought it, I put it in my mouth, and then moving it.
I did too. It's too laborious.
It's laborious, and what's the reward? And it's nothing. Just if the patients would follow the instructions and they want to add oil pulling, please do. But I think it's a bit redundant. Yeah. And it does not have the touted effects that are claimed.
Thank you very much.
Of course, my pleasure.
So Dr. Al-Rashid, this was amazing. I mean, I think I personally learned so much, and you'll keep coming back to our program.
Excellent.
And enlightening us. And I just wanted to wish you a very, very I connected with Maha too. So
yes, love that.
And so thank you so much, Dr. And any final comments before we end?
Again, thank you again. I really appreciate the chance to come and talk to you and your patients and core kidney. I think that dentists and doctors have to talk more. And I loved in our brief chat that we had the day we met, that you told me, the discussion was, can we talk to residents and like tell them to make sure to tell their patients to go and see the dentist? And Dr. Rastogi was, no, we need to empower the patients. And I think that that's the best word. We need to empower the patients, that they are in control. I think when someone has kidney disease or many the comorbidities, there is a loss of control. So giving them something that they can control and that has been proven to work, I think that has excellent effects for them.
I think you're also a psychologist.
Integrative. You can't, holistic approach. I think a dentist needs to wear a lot of hats. I think a psychologist could be one of them. And I did take classes in psychology, just so you know.
I think they would agree that you're right on with all your psychological advice you're giving. I think it's very important. In every walk of life, actually, you know.
Exactly. Yeah. I did want to mention something that I did not mention. I was talking to one of the periodontists at UCLA, and she told me, please mention the direct effect that professional scaling root planing and maintaining good oral health has on diabetes patients and controlling diabetes. Thank you very much. Thank you. Have a good night, everybody.
Thank you. Bye for now.
Bye.